East Cooper, an area covering approximately 1,500 square miles of northern Charleston County, is home to a diverse population. Some are very wealthy, but most are not. In fact, almost half of the residents are experiencing deficiencies in housing, employment, and health care. Fortunately, there is a special place where the uninsured and underinsured can obtain free medical services. It's called the CARES Clinic. Modeled after a student-run free medical clinic she helped to reorganize at the University of Kentucky, the CARES facility was opened in 2005 by Dr. Wanda Gonzalez, Associate Professor and Medical Director of the Physician Assistant Program at the Medical University of South Carolina. Dr. Gonzalez conceived CARES as a healthcare clinic that would also provide experience for interprofessional studies, including medical, physician assistants, physical therapy, pharmacy, and Masters of Hospital Administration students.
The same principles that made the University of Kentucky Clinic so successful are at work here. Rather than impose a rigid organizational structure on the students, I advise them on the basics and provide feedback on their performance. But I let them determine their own organizational structure. As a result, they become fully invested in the clinic's operation and take special pride in its day-to-day operations.
The CARES model also gives students a unique opportunity to develop communication and management skills that will be essential to their professional careers. Ongoing board meetings promote ideas for improving care, managing resources, and monitoring performance. For new students taking part in the clinic's operation, such as first-year physician assistant student Megan Elvis, volunteering at CARES fulfills her desire to help those in need while learning new skills.
I'm Megan Elvis. I'm a first-year physician assistant student at MUSC. I volunteer at our CARES clinic because not only do I get to help people out in the community, I also get the clinical experience that I need to learn how to practice in the real world.
For seasoned volunteers, like fourth-year medical student Brandon Brown, the CARES experience can facilitate a more successful transition from classroom study to clinical implementation.
Hi, I'm Brandon Brown. I'm a fourth-year medical student here at MUSC who's been working at CARES Clinic for some time now, and it's been a very rewarding experience and a way for me to practice my physical exam that I've learned in school, and also to take the knowledge that I've learned in my first 2 years of medical school and implement it in your clinical years.
For Megan, Brandon, and their fellow students, participating at CARES does not mean simply showing up and seeing patients. It means making sure the clinic functions on a day-to-day basis. That includes scheduling, records management, resource allocation, and patient services, and of course, taking care of patients. Patients like John, one of the thousands of East Cooper residents who have come to depend on CARES for his health care.
I've been coming to CARES for approximately 2 years, and they've been a lifesaver for me. I was diagnosed with diabetes, and I didn't know where else to go. Someone told me, well, there's a clinic in Mount Pleasant. And I called, and they said, well, come on. I feel like they're doing me a favor, and I'm doing them a favor by letting them practice. Anybody that asks me, where do you go, at CARES Clinic, and I've never had a bad experience.
CARES also depends heavily on the services of doctors who freely give of their time, talents, and energy to serve those in need. Their experience at CARES is especially rewarding, as Dr. Victor Delbeni describes.
My name is Victor Delbeni. I'm a retired internal medicine infectious diseases physician. I've been in practice for many years, and I've taught students many years at the medical university. And one of the reasons I come here to the CARES Clinic is to continue to do some good while I'm retired, but also to have the opportunity to watch students develop and maybe give them a small bit of my knowledge so that they can carry on and do good work.
In the short time that CARES has been operating, it has proven to be a huge success. With the popularity of its service learning elective, Caring for the Community, more and more students are participating in the program. Thankfully, the community has embraced CARES as well, through the participation of professional volunteers and continued financial support. But in order to grow, the clinic faces several challenges. These include the need for more space, reliance on consistent funding, and adequate staffing by faculty members or community professionals who must be in the clinic at all times to provide oversight. It is the faculty staffing issue that Wanda Gonzalez hopes department chairs will consider in depth when discussing how to support the CARES Clinic.
Of course, we would like to expand our hours of operation, but not at the expense of our students and professional staff. We need to develop some creative ways to incentivize faculty participation so that participation increases.
Despite these challenges, it's highly probable that the CARES program will only flourish and grow. As Dr. Gonzalez infuses the CARES program with her energy and her enthusiasm, more students infuse their enthusiasm and their energy into the program and manifest themselves in student volunteers like Megan Elvis, Brandon Brown, and the others. For those on campus looking for a model for interprofessional education and collaborative healthcare, they need look no further than the CARES Clinic. It's here, it works, and it's in our own community of East Cooper.